You know, the way we've all thought about chronic obstructive pulmonary disease, or COPD, is fundamentally changing. The brand new Gold 2025 guidelines are out, and trust me, this isn't just some minor tweak. It's a complete paradigm shift in how we're supposed to manage this disease. So let's break down exactly what's new.
I want to start with just one number, 50%, because this number, right here, completely reframes the entire conversation around COPD. For decades, the public image of this disease has been locked onto one thing, smoking. Well, this number is here to shatter that image. That's right, more than half of all COPD cases worldwide are now linked to factors that have nothing to do with smoking. We're talking about things like air pollution, both indoors and out, stuff you're exposed to at work, and even events that happened way back in childhood. And this is the first huge takeaway from the new guidelines. COPD is not just a smoker's disease anymore, not by a long shot.
So here's what we're going to cover. We'll start with how the very definition of the disease is changing. Then we'll get into how we can now catch it earlier than ever before and unpack the new ABE framework for assessment. After that, we'll dive into some really cool targeted treatments, and we'll wrap up by looking at why managing the whole patient is really the future of COPD care.
All right, let's start at the very beginning. The new guidelines are getting much more precise with the definition of COPD itself. It's about moving past that simple idea of a smoker's cough to really reflect how complex this condition is.
Let's unpack this, because there are three key parts. First, you've got the chronic respiratory symptoms, things like being breathless, coughing all the time. Second, you have actual structural damage to the airways or the tiny air sacs in the lungs. And third, all of that leads to a functional problem, persistent airflow obstruction, which has to be confirmed with a breathing test called spirometry. So symptoms, structure, and function. Remember those three pillars.
Okay, this is maybe the single biggest change in Gold 2025. There is a massive new push to identify people who are at risk before they have full-blown COPD. And this is a total game changer.
And this slide really shows you why catching it early is so critical. See, we all build up our lung function to a peak around our early 20s. After that, a slow, normal decline is expected. But there are two main ways people get to COPD. Either you start with a lower than normal peak because of things that happen in childhood, or you have a much steeper, faster decline later in life from things like smoking or pollution.
And that brings us to this brand new term, pre-COPD. The best way to think about this is to compare it to pre-diabetes. It's the same idea. These are people who already have symptoms, or maybe even early damage you can see on a CT scan, but their main breathing tests are still coming back normal. This is a huge red flag. It identifies this crucial window of opportunity where we might be able to step in and stop the disease from ever progressing to full-blown COPD. Then there's the second new term, PRISM. This is another at-risk group with a specific, kind of funny-looking spirometry result. Now, they don't technically have COPD, but here's the kicker. They have a much higher risk of death from all causes, especially from heart disease. And this just drives home a central theme of these new guidelines. Your lung function isn't just about your lungs. It's a marker of your global health.
Okay, so let's say a patient is diagnosed. How do we assess them? Well, the old ABCD tool is gone. It's been replaced by a much simpler and, frankly, more intuitive ABE framework.
So, step one is what you'd expect. You have to confirm the diagnosis with that spirometry test. The gold standard is still making sure that the ratio of how much air you can blow out in 1 second versus your total lung capacity is less than 0.7 after you've taken a puff from an inhaler.
From there, you grade the severity of the airflow limitation. This gives you the gold 1 through 4 score, which just tells you how severe the obstruction is, from mild to very severe.
But this is the step that really matters for treatment. Step 3 is where you look at how bad the patient's symptoms are and, critically, what their history of flare-ups or exacerbations looks like. This is what's going to put them into their therapy group.
And it all comes together in this new ABE tool, which is just beautifully simple. If a patient hasn't had many flare-ups, they're either in Group A for low symptoms or Group B for more symptoms. But, and this is the big change, if they have a history of frequent or really bad flare-ups, they go straight into a single category, Group E for exacerbator. This one high-risk group replaces the old C and D groups, and it powerfully signals that preventing these flare-ups is priority number 1.
So, this new way of assessing patients leads directly to more personalized treatment. The era of a one-size-fits-all approach is pretty much over. We're now moving towards what's called a treatable traits approach.
And here is a perfect example of a treatable trait.
It's the blood eosinophil count. Eosinophils are just a type of white blood cell. And as this quote from the report makes clear, a simple blood test can now tell us which patients are most likely to get a real benefit from using inhaled corticosteroids, or ICS. It's all about finding a biological marker to guide us to the right therapy.
The follow-up plans have also gotten a lot clearer. Let's say you have a patient, and their main problem is just being breathless all the time. Well, now there's a clear, logical escalation plan. You start with one type of long-acting inhaler, then you move to two, and if they're still struggling, you start to investigate other things, like if they're using their inhaler correctly or if maybe a different drug would work better for them.
And this is huge. For the first time ever, the GOLD guidelines now officially include advanced biologic therapies. For those high-risk Group E patients, the ones with high eosinophil counts who keep having flare-ups even on triple inhaler therapy, a biologic drug like dupilumab is now an option. This is a massive step forward, bringing the kind of precision medicine we've seen in other fields right into the heart of COPD treatment.
But the new guidelines are screaming this from the rooftops. Medication is only one piece of the puzzle. To really manage COPD effectively, you absolutely have to manage the whole patient. And this slide just drives that point home. Look at the data for things like smoking cessation and pulmonary rehab. They don't just make people feel better, they are proven to reduce the risk of dying. These aren't just optional add-ons. They are life-saving interventions that have to be a foundation of COPD care.
Preventing infections that can kick off those dangerous flare-ups is also a huge priority. So the list of recommended vaccines has gotten longer. We're not just talking about the flu and pneumonia shots anymore. Now the list includes Tdap, shingles for folks over 50, and the new RSV vaccine for those over 60.
And finally, the guidelines really hammer home that COPD is a systemic disease. It affects the whole body. That chronic inflammation that starts in the lungs, it spills over and dramatically increases the risk of heart disease, osteoporosis, and depression. Managing these other conditions isn't a secondary thought anymore. It is a central, critical part of good COPD care.
So if we put it all together, the old view of COPD is basically obsolete. The GOLD 2025 guidelines have given us a new paradigm. COPD is a diverse, systemic disease that starts way earlier than we thought. It requires personalized treatments that are based on specific, treatable traits, and it demands a holistic approach that brings in rehab, vaccinations, and comorbidity management.
And this all leads to one final, really exciting question. As we start moving from just general inhalers to these highly specific biologic drugs that can target the underlying drivers of the disease in individual patients, are we finally stepping into a new era? An era where treating COPD could become as precise and personalized as modern cancer therapy? Well, the GOLD 2025 guidelines certainly suggest the answer is yes.